explained and examined in this presentation is the Behavioral Risk Factor Surveillance System, or for short, Brfss. On the title page, you can also see its symbol, which is a green and blue arrow creating a circle. Just some general information to know about Brfss is that it was established in 1984. It is collected in all 50 U.S. states, the District of Columbia, and 3 U.S. territories. Brfss users continue to increasingly demand more data and questions every year. This data set is sponsored by many different organizations. First, it is sponsored by many divisions in the CDC. It is also sponsored by Health Resources and Service Administration, Administration on Aging, Department of Veterans Affairs, and Substance Abuse and Mental Health Service Administration. The reason the Brfss is so important is because of the type of data it collects. It collects residents' info regarding 3 different categories: health-related risk behaviors, chronic health conditions, and the use of preventative services. The Brfss is responsible for sending out surveys monthly. It averages about 400,000 adult interviews every single year, which makes it the U.S.'s leading system of health-related phone surveys. This data set has 3 different ways of collecting its information. The first is telephone interviews. These are voluntary, random, and anonymous. No name or address is collected during any part of the survey or interview. This includes landlines and cell phones. The second is cellular surveillance survey, and lastly, in-house interviews. The Brfss has 3 different types of questions that they ask. First is the core questionnaire. This includes demographic characteristics and their health behaviors. Second is optional modules. These are on more specific topics, such as smokeless tobacco. And lastly, each state can add their own individual questions. The core component questions rotate even in odd-numbered years. They have demographic questions, and as well as current health-related perceptions, conditions, and behaviors. More specifically, they look at health status, healthcare access, alcohol consumption, tobacco use, consumption of fruits and vegetables, and HIV/AIDS risks. Optional modules are questions that the CDC recommends asking, but states can elect to use on their questionnaire. They look at more specific topics, such as prediabetes, diabetes, sugar-sweetened beverages, excess sun exposure, caregiving, shingles, and cancer survivorship. State-added questions are questions that each individual state comes up with on their own. The CDC does not edit, evaluate, track, or report responses to any of these questions. It is strictly for that state's use. This flexibility allows states to specialize on their own needs. However, state-added questions cannot be added, changed, or deleted at any time throughout the year's collection period. The Brfss is responsible for collecting data on many different variables. The following are the major topics before states add their own additional questions: smoking, body mass index, alcohol consumption, age, gender, race or ethnicity, marital status, income, education, and metropolitan residence status. Indiana uses the Brfss for many reasons. It is used to monitor the Health People 2010 progress, produce educational materials, help the Indiana Arthritis Foundation plan interventions, compare the country versus the state's cardiovascular disease mortality, share information and results of programs surrounding cardiovascular disease. It also analyzes the risk factor status of pregnant women compared to other women who are of childbearing age, judge the validity of birth certificate data, and also assesses the burden of asthma. Briefly going over the 2021 summary of the Brfss, the core questions asked during this year were about health status in healthy days, exercise, hypertension awareness, cholesterol awareness, chronic health conditions, arthritis, tobacco use, fruits and vegetables consumption, and healthcare access. The optional module topics were often about prediabetes and diabetes, cognitive decline, caregiver, cancer survivorship, and sexual orientation or gender identity. As previously mentioned, the Brfss is utilized in all 50 U.S. states and a few additional surrounding areas. The data is free and the public is easily able to access it. There is a link to their official website on the slide as well for personal use. The purpose of the Brfss is to help make and track state and local health objectives. With this, officials can plan health programs, implement disease prevention and health promotion activities, and monitor trends. Beyond these things, 2/3 of the U.S. states even use the dataset to support health-related legislative efforts. Information that the Brfss consists of can also be used, and often is used, as a reference for others' research. There are many countries that are eager to start utilizing the United States' database, including Australia, Brazil, Canada, China, Egypt, Italy, Jordan, South Korea, Mexico, nations in the Caribbean, and Vietnam. If interested in locating specific information or have specific questions, the Brfss's email and phone number have been listed on this presentation.